Back and neck pain. From a dull, constant ache to a sudden sharp jolt. It affects almost everyone. Welcome to We've Got Your Back, presented by Penn State Hershey Spine Center. Your chance to speak directly with leading physicians about the causes and treatments of back and neck pain.
Good evening, I'm Deborah Pinkerton. Thanks for joining us. Back and neck pain are two of the most common chronic conditions. In fact, it's the leading cause of disability in Americans under the age of 45. And over 26 million Americans between the ages of 20 and 64 experience persistent back pain. Tonight, a panel of medical experts are here to answer questions on the various treatments available. And joining us here in the studio is Dr. Vitaly Gordin with Penn State Hershey Spine Center. And in our ABC 27 call center, there's a group of specialists from the Spine Center. Chuck Rhodes is here to tell you how to get in touch with the doctors. Hi, Chuck.
Hi, Deborah. It's very simple. Just pick up the phone. You see the number 346-3333. If you have any questions, ask the doctors here during the next half hour. Now, your questions will not be heard on the air, and any personal information you give the doctor will be between you and the doctor, and we'll keep everything confidential. However, we may share your question with the viewers at home. That's the purpose of the call-in show. And I want to tell you, we won't be able to get to everybody calling in, but we will have the doctors follow up with you at a later time. So it's busy already, Deborah. We're off and running.
And thank you, Chuck. Now, Penn State Hershey Medical Center has a newly built spine center. Dr. Gordon is here, and he can tell us why was it created.
Well, as we all know, that low back pain and pain in other parts of our spine is costing our society tremendous amount of dollars, millions and millions of dollars in healthcare, in lost productivity, in disability payments. It also takes tremendous toll on the family and the patient, him or herself. Any healthcare provider who deals with the patients with chronic low back pain or pain in other areas of the spine knows that the pain is multifactorial, and it's best approached by a team of highly trained specialists who can work side by side and decide what would be the best treatment approach for an individual patient.
And they're going to be all in one house. You're going to have an open house later this month. Why don't you tell us about it? Tell us the date and times.
Our open house will be on Saturday, March 29, from 10 o'clock in the morning until 2 o'clock in the afternoon, where the public will have an excellent chance to meet the specialists who will be working in the newly opened spine center, such as orthopedic and neurosurgeons, such as pain management practitioners, such as rehabilitation physicians, interventional radiologists, physical therapists, and other specialists.
It seems that everyone you talk to, including myself, we all have back pain or neck pain. What can you do about it?
Well, in the vast majority of cases, the pain will go away if you will use simple modalities such as over-the-counter painkillers, heat, or ice. In certain cases, using relaxation techniques such as imagery, deep breathing, distracting yourself from pain by performing certain activities such as reading an interesting book, watching a show, hopefully a show like we have tonight, will allow you to forget about pain. Also, pacing yourself through the day, alternating activity and rest will also help dealing with pain.
Now, the other things, you have to see a doctor.
Yes, you do. And specialists in the spine center can offer medical management with nonsteroidal anti-inflammatory agents, with other painkillers. We can perform fluoroscopically guided procedures in the spine, and in many cases, physical therapy or rehabilitation program can help those patients. In certain cases, the patients will require having a surgery.
Okay, now why don't we check in with Chuck Rhodes to see what questions our viewers have asked. Chuck.
I'll tell you, what we're dealing with now is a very busy room in here. I want to take a minute before we get to the first email question, introduce you to our panel of doctors here this evening. We're starting with Dr. Dave Black, physician's assistant, neurosurgery, Dr. David Giampetro, and pain medicine specialist. And we have over in the corner there Dan Quinn, and I got to get his title because that's a tough one on me. That's interventional neuroradiologist. and Dr. Vogman Vora, orthopedic spine surgeon, and my co-anchor for this event. I'd like to introduce Dr. Everett Hill. And Doctor, you've been with this organization to see this big change coming up here. Tell us about one of the questions that just came in here this evening.
Well, I had a question about an individual who had both neck and back problems, and they were looking for help, and it was a relatively recent event for them. And they were looking for where to start with a direction.
You see the question on the screen up there, and that's what they came up with. What would you tell them at this stage?
That's a problem that probably needs to be looked at in totality, looking at their images of their spine, looking at their general physical shape, looking for other comorbidities, problems that might be accompanying it. Particularly an injury like a sacroiliac one can masquerade as low back pain in a lot of areas.
So follow up on it.
They need a complete follow-up on that, yes.
That's probably a common theme we're going to hear throughout this evening here. You can't do that much on a quick phone call, but we encourage you to keep calling, and we'll keep the numbers on the screen right through the program.
Thanks, Chucky. I'm sure a lot of people are going to have questions tonight. And thank you, Dr. Gordon, for joining us this evening.
It is my pleasure. We all specialists at the new Spine Center are looking forward to providing care to the patients in central Pennsylvania. Thank you very much for having me.
Thank you. And in our next segment, we'll talk about other types of treatments for back and neck pain, and we'll learn how a teenager from Cumberland County survived a devastating car accident. We'll be right back.